people with typical hearing, sound waves enter the pinna, travel through the ear canal, and cause the eardrum to vibrate differently depending on the pitches of the sound. This creates movement of the ossicles, a chain of 3 tiny bones, the innermost of which strikes the cochlea. Subsequently, the motion of the fluid inside the cochlea triggers movement of its inner lining of tiny hair cells. The hair cells then convert the mechanical energy to electrical impulses, which are sent to the brain via the auditory nerve to be interpreted as sound. 2 or 3 of every 1,000 babies born in the U.S. are diagnosed with hearing loss, and an even greater proportion of people acquire hearing loss as an adult. But those who are born with or develop hearing loss have more options today than ever before. Just like the technological evolution that's occurred in areas such as media and transportation, medical technology has made substantial growth in recent decades. Modern advancements have given people with hearing loss a multitude of ways to access speech and other sounds around them. Hearing aids are among the most commonly used devices to support people with a variety of hearing loss severities. Additionally, they were the first to be developed centuries ago when people used animal horns to funnel sounds into the ear. This rudimentary design and function served as a starting point for the conventional hearing aids used today. Now, hearing aids digitally amplify sound waves to a level that a person can hear as they enter the ear and pass through the ear canal. In the latter part of the 20th century, another hearing device called a cochlear implant was invented for people with severe levels of hearing loss. However, these devices work quite differently than hearing aids. The external piece of a cochlear implant is worn on the outside of the ear and converts sound waves to electrical signals that go through the skin to a surgically implanted portion. The sound bypasses the impaired part of the ear, the cochlea, to stimulate the auditory nerve and be processed by the brain. A third hearing device, called a bone-anchored hearing aid, or BAHA, became commercially available in 1987. This device is positioned on the hair and skin behind the ear and turns sound into electrical vibrations. The vibrations permeate the bones of the skull into the normally functioning inner ear or cochlea, making the BAHA a logical choice for individuals with structural abnormalities in the outer or middle portions of the ear. Various professionals and specialists help people manage their hearing loss. An ENT, ear, nose, throat, doctor helps evaluate the structure of the ear and determine the cause of hearing loss. A clinical audiologist assesses the type and severity of hearing loss, determines candidacy for a device, and programs and monitors these devices. Teachers of the deaf, speech-language pathologists, and educational audiologists assist school-aged children with accessing the curriculum and progressing in school. Find printed and digital versions of this passage and activities to go with them in the link in the description.